To measure for forelimb circumference, and why would we measure for forelimb circumference? There's numerous reasons. Say you can't quite tell if it's the left forelimb or the right forelimb that the dog's having the issue with. Well, just measuring for a difference in circumference can sometimes help to clue you in as to which limb it is. Another reason, as you're following them through recovery. Say you're doing rehabilitation therapy or it's post-surgical and you're in rehab and you're really trying to determine objectively, are they continuing to progress appropriately, to look and see that that muscle mass is improving over time. Okay, so we want to be able to have these objective measures. So to do that, you can use a Golic, you can use a tape measure. This is just your simple tape measure. Try to have them standing squarely, okay? Then the next thing we want to do, we'll stack them up. I want you to not measure the distance between the shoulder and the elbow and try to find the difference, the middle or the proximal third. It's so hard to do that. I want you to have a location that you can come back to every single time, and it's the same time on both locations, same location, and you can find it easily. So that's going to be your acromion process. That same structure we use when we're doing injections or dropping a needle scope into the joint, the same structure we use that we stabilize when we're testing abduction. So the acromion process is really important. So I'm going to find that. I'm going to take my tape measure. I'm going to run it under the forelimb. I'm going to go way up into the axilla, just kind of incorporate all the soft tissues, the fur, everything that you can capture. Now we're going to go ahead and find that acromion process, bring the one tip of our tape measure to the acromion process, bring the other tip over with similar tension that we have on it, and we're going to crisscross these over right at the acromion process. And this is going to be 31 centimeters, okay? So we can repeat that multiple times to make sure we're getting the same measurement. And we can always go to the exact same location on the other side because the acromion process should be identical on the opposite location, the opposite limb.